Hi, everybody. Welcome to another edition of the Oldish TV. As always, my name is Karen, and it's my pleasure to be your host. Today, I want to talk to you about oral health. Your pearly whites. I went to the dentist this week, and I think since COVID started, this is the first time I've been able to get in because for a time they were shut down and now they are operating again. And I have to tell you, it was such a safe environment. The dental hygienist had on an N95 mask and a face shield and full PPE garments. They were able to do the complete cleaning. I know my daughter uses the same dental hygienist. She went a few months ago, and they didn't do the water spraying, so it was like half the job, but at least it was something better than nothing. This week when I went, I got the full job and felt abundantly safe with all of their routines. So don't skip the dentist. You need to go. But it did put me in mind of the need to talk to you a little bit more about it because if you don't go, lots of really scary things happen. And I think particularly as we age, and for those of you who may be caregivers and responsible for oral hygiene for the people to whom you are giving care, there are some particular things that you should be doing too. And, if you're looking after somebody who is nonverbal or no longer has the words to tell you that something's not right, then there are some other things that you need to work toward. And, I think one of the things you certainly can do is go and see your dentist and talk with them about the things to be looking for. But I'm going to give you some heads up pieces about oral hygiene. Um, if you have sore teeth, dentures that don't fit quite right, perhaps canker sores, this can all point toward any number of things. And the end result is that you stop eating properly. You may not be interested in eating at all, or certainly not anything that has to be chewed because to chew hurts. And that's not a good thing. You need to make sure you're getting your proper nutrition because this certainly speaks to all of the other operations in your body. If you're not having proper nutrition, you're not fueling your body properly to think clearly, to be able to get the exercise in that you need to get. There are just so many things that it affects down the line. So it's best to just take care of it and know what you're looking for. So some of the health related conditions that show up in your mouth that your dentist can notice surprised me. I knew that they looked for mouth cancer. They push your tongue to one side and then to the other, and they're looking for things. But did you know that diabetes shows up in your oral hygiene? I didn't know that. TMD, temporomandibular disorder, that's something they look for. HIV, AIDS shows up in your mouth. Thyroid problems, iron deficiencies, leukemia, and bulimia and anorexia, all of these things show up in your mouth, and your dentist can spot them. Imagine. So it's not just your teeth. Seniors who live in long term care, whether it's a residential facility, a long term care, or a nursing home care, are already, in general terms, medically compromised. So making sure that their teeth and gums are in good shape is really important so that all of these things don't gather together in a perfect storm and result in other problems for them. As we age, our taste diminishes. This is something you can watch out for, even if you live independently, but certainly for the people to whom you may be providing care. When taste diminishes, our tendency is to try to ramp up the flavor. Some people do that by adding more salt to their food. So if you are the adult child of someone who is older and living independently, maybe take a look at that salt container and just measure how much of it is being used. Just a thought. Just a thought. Hot sauces and other kinds of things that can burn the gums can also be used. I'm not sure that hot sauces per se are as much of a thing in Canada. I mean, we certainly have people who like hot sauce, but it's not necessarily a regular part of our routine the way it is in some countries. So just keep an eye on that. Also, as we age, the enamel on the teeth wears away, and that makes us more vulnerable to damage and decay. So you got to watch for that as well. Drugs, as always, the medications we are prescribed and the over the counter medications we choose to purchase and consume have an effect on our oral health. There are some 500 medications, just as a for instance, that can cause dry mouth. Hmm. Now, dry mouth is something that makes the gums get thinner. And when they do that, they recede. The gums recede and it opens people up to more cavities. So you want to make sure that that is not something that is being caused by one of the medications you take. So, those little pamphlets that you get at the pharmacy? Yeah, read them. Read it and make sure that dry mouth either is or isn't a side effect of that given medication. If it is a side effect, you can take steps to counteract it. And that's a really important thing. Now, on the other side, there are drugs that cause overproduction of saliva, and that will bring with it bacteria which settle amongst the teeth and in the gums. So, both sides of the equation. Back to those 500 medications. There are medications included in that grouping that are prescribed for allergies, high blood pressure, Parkinson's disease, Alzheimer's disease, high cholesterol, pain, anxiety, depression. I mean, it runs the gamut. So do make sure you know whether the drugs that are being prescribed or the ones that you are just choosing to buy over the counter are likely to produce dry mouth or an overproduction of saliva. You want to know both because you can take steps to counter them. Okay? Periodontal disease is a very destructive disease of the gums and all of the structures in your mouth that support the gums. And what it is actually a long term buildup of bacteria. Here's the thing, it's generally painless. You don't know it's happening until your teeth start to get loose and maybe fall out. We don't want that to happen. Um, so, some of the causes of periodontal disease are smoking, poor oral hygiene, and also people who have conditions like diabetes, people who have poor nutrition, people who may have leukemia or AIDS. They are all particularly susceptible to periodontal disease. This is something that, with regular visits to your dentist, can be highlighted and prevented entirely or reversed. So you want to keep tabs on that. If you're a caregiver, you want to establish a really good routine of brushing and flossing the person to whom you are providing care. Now, the little flosser things that I like are those little sticks. You buy them in packages of 100 or 200, whatever they are. They're just little plastic sticks that have a little piece of floss in them, and you can work them in between the teeth. I have found those in recent years to be a lot more helpful than a roll of dental floss. So I've pretty much stopped using that kind of dental floss in the roll, preferring instead to use the little pick things. So look for those rather at your drugstore, and you will be able to find them and buy them in gigantic packages. So I keep them in my purse. I keep them in my bathroom. They are everywhere because they're very, very helpful, small and easy to maneuver. Okay, that is our show for today, but I do want to implore you to keep up your dental visits, even during this time of COVID. I know that for some people who don't have healthcare plans, and I don't have a healthcare plan, I pay every time I go to the dentist, and I go every 3 months. I think my bill this time was $284, but I got x-rays. It was time to get x-rays every 2 or 3 years. So it would have been less without the x-rays, but it is a worthwhile expense to make sure that you can get your proper nutrition because your mouth is healthy, that you can eat the foods that you need to eat to keep your body strong and properly fueled. It is just such an important thing. So there you have it. There is my message to you this week. Please join us again next Wednesday at 12 noon, when we will have another topic for you. Until then, do take care of one another. Take care of yourselves. Do remember that it takes a village to age a senior. Bye.